A very good morning to one and all. I'm Dr. Priya Singh. I'm an associate professor in the Department of Oral Medicine and Radiology. And today I'll be discussing a very important aspect of radiology, that is radiation biology. Now, radiation biology is something which gives you insight into, till now, we have talked about all the good effects of X-rays. But now we'll discuss, apart from seeing into the vicinity of an individual, X-rays, it has effects on human body, either direct or indirect. So we'll see them individually. Radiation effect at a cellular level. And as it progresses, when cells combine to form a tissue, then organ, and finally the organ system. But as a dentist, it's very important for us to understand the effect on the oral cavity. Followed by that, it's very important to know the sequelae of whole body irradiation. And even the X-rays, they are responsible for carcinogenesis. But I'll be discussing in length the radiation effect on the oral cavity, because as we know that dentists will visualize the head and neck region more as compared to the rest of the region. So it will be easy for us to identify if there is any change in either the oral mucosa or maybe the hard tissue. So it's very important that we should be knowing what all effects the X-ray can have on us, so that judicially we can advise radiographs. Now, dosimetry. See, after we found out that radiation, X-ray radiation can lead to debilitating consequences, now the need for dosimetry, which is to quantify the radiation exposure or the doses, came into being. And various terms, that is exposure and absorbed dose, then became very important, so that we can identify that maybe the personnel who's actually doing the technique and even the individual who has been advised radiographs are not exposed beyond a certain limit. So there are two effects that we should be knowing about, that is the somatic and genetic effect. Somatic is seen in the person who's basically irradiated. And usually the example of somatic changes in the body will be cancer and cataracts. It is, however, not transmitted to future generation. However, now coming to genetic effect, it is not seen in the person who's irradiated, but it might be seen in the future generation. It do not affect the health of the exposed individual, but definitely can affect the coming generation with the changes. So as you can see in this particular slide, somatic effect affects the individual who's irradiated, whereas genetic will first affect the offspring, followed by the changes in the cell, tissue, organ or organ system. So very important to understand that how it happens. Now this can happen either directly or indirectly. Directly will be photon ionizes biologic macromolecule themselves. And these are the cases which are seen about 1/3 of the total irradiated individuals. Whereas indirect, which is approximately 2/3 of the changes seen, it is changes in the water molecule, which leads to formation of the free radicals and thus exposing the individual and changing the biologic macromolecule by which we are formed. So these transfer molecules might lead to carcinogenesis if they are bundled up in large amount. So very important to understand that X-ray should always be advised with precautions, and as much as possible, we should keep into mind that individual should not be exposed beyond a certain limit. So all the precautions which can minimize the effect of radiation should be taken care of. There are basically 5 types of cells which our body is formed of. Vegetative, intermitotic. These are the cells which divide regularly, and these are the ones which will be affected most because of X-ray radiation. which is nothing but your sperms, erythroblastic cell, basal cell of oral mucous membrane. So as a dentist, it's very important for us to understand oral mucous membrane. That is the highly vegetative cells and will show maximal changes following X-ray radiation. Followed by that is differentiating intermitotic, which includes your hematopoietic cell and inner enamel epithelium. Multipotential connective tissue, that is your vascular endothelial and fibroblast. Whereas reverting will consist of acinar, ductal cell of salivary gland, pancreas, parenchymal cells of liver, kidney, and thyroid. And finally, the fixed post-mitotic cell, as the name itself states, that it will not further reproduce or further regenerate. That is why these are the cells which will be least affected by X-ray radiation, which includes your neurons, striated muscle cells, squamous cell close to surface of oral mucous membrane, and your erythrocyte. So now, depending upon whether the radiation has been to the individual for a short term or maybe for a long term, the effect will be seen in an individual. So this I have already told you that the highest radiosensitive cells will be your lymphoid organs, bone marrow, testes, intestine, and mucous membrane. Intermediate is fine vasculature, growing cartilage, growing bones, salivary gland, lungs, kidney, and liver. Whereas low will be your optic cell, mature erythrocyte, muscle cells, and neurons. So the long-term effect will definitely have irreversible changes in the individual. So we have to always keep into mind that whatever we are doing, we should be able to justify that. Now, coming to the changes, main changes that we'll see in oral mucous membrane, as we have already seen that it is the most vegetative cell, and that is why the maximal effect will be seen in your mucosa. So mucosa will lead to mucositis. Now, mucositis is nothing but inflammation of the oral mucous membrane. Remember, if there is inflammation secondary to X-ray radiation, there'll be chances of bacterial, fungal, and viral infection. So depending upon what kind of presentation your oral mucosa is showing, we can differentiate and identify it to be either bacterial, fungal, or viral. And depending upon the presentation and finally the investigations done and diagnosis made, we can do the treatment plan likewise. So very important that such patient where mucositis is seen, we know that the keratin turnover rate, that is the turnover rate for a new whole mucosa to form, is about 14 days. So for 14 days, we have to give patients some kind of palliative treatment. That is, there will be a lot of burning sensation in the patient. Patient will not be able to eat his food because of the fact that the mucosa will be completely atrophied or maybe at times even erosive. So we can go for topical analgesic or anesthetic. It can even lead to psychological effect. Continuous oral pain will definitely affect the psychology of an individual. Nausea, vomiting, diarrhea, abdominal pain, joint pain, headache, all erode the cancer patient's feeling of well-being. Oral and oropharyngeal pain can interfere with sleep. Patient can become discouraged, depressed, anorexic, and physically weakened due to weight loss and inadequate sleep. If there is high radiation, remember when we are talking about oral mucous membrane, definitely it can affect even your taste buds. Taste buds, they are very radiosensitive. So loss of taste in second and third week of radiotherapy is seen at a very large scale. Bitter and acid flavor more severely will be affected when posterior 1/3 of the tongue will be irradiated, whereas salt and sweet when the anterior 1/3 will be affected. And even the effect will be on the saliva. Patient will usually become dry, will either have the dry mouth or the extreme condition that is xerostomy. So it's very important in such patient to give zinc supplements such as zinc sulfate, which will help in healing of the mucosa. So healing definitely will, to some extent, will return back the taste perception in the individual. Salivary gland. So when oral mucosa can be affected, salivary gland is very near to it. We know that we have opening of the parotid gland, that is your Stenson's duct, just adjacent to your maxillary second molar. Then there is your there is ducts of your submandibular salivary gland and sublingual salivary gland at the floor of the mouth. So all of them can be exposed. Parenchymal component, they are more radiosensitive. Parotid gland as compared to your submandibular and sublingual gland are more sensitive. This is because of the location of the parotid gland. So mouth will become dry, tender, and as we have already seen that when the patient will become xerostomach, the mucositis will further aggravate. So cellular basis for xerostomia will be in the form of inflammation, particularly involving serous acini of the salivary gland. Progressive fibrosis, adiposis, loss of fine vasculature, parenchymal degeneration. So very important to identify this. Then one very important structure, that is your hard tissue. Apart from the soft tissue involved, the teeth, the hardest tissue of a body, that is your enamel, can also be affected by it. So adult fully formed teeth, they are completely, they are as such radio resistant as compared to rest of the individuals where growth and development will be seen. So this is how a dwarfed root will look like. This is how the whole of the dentition will be affected. So leading to radiation caries, and definitely the health of the hard tissue will be affected. And finally, it is the bone which will show you osteoradionecrosis. So to end my lecture, I would like to state that it's very important for us to judicially use this X-ray, and we should keep in mind that the benefit of X-ray should be kept in mind rather than the effect which can act as a biologic weapon, or it can be detrimental, as we have seen in various world wars. So with this, I end the lecture, but it's important to read about the cellular changes that takes place when we are exposed to X radiation. Thank you.